Welcome everyone, and today we are at the Thoracic Surgery Academy podcast, and we are talking about Macedonian education program about the thoracic surgery. In this education program, we are talking about the different surgeons from different countries, and also we are talking about their clinic differences between our country, Turkey. So today our guest is Dr. Besnik from Macedonia, and dear Besnik, could you please talking about yourself, please?
I am Dr. Besnik Mustafa. I'm the thoracic surgeon in the clinical hospital in Tetov in North Macedonia. We are four thoracic surgeons in our hospitals. In our hospital, we have more than 300 doctors, and we are around 400 beds. Our clinic is interested about breast surgery, thoracic surgery, and lung surgery.
How many operations you perform per year?
We are performing around 200 operations per year, but here in Macedonia, we are not working just in chest surgery. We are working also in breast surgery and thyroid surgery. We are making.
So it's different from our country because in Turkey and some of the European countries, the thoracic surgery is an isolated specialty actually. So we are only operation from the thoracic cavity, sometimes esophageal surgery. But you said that it's different from, you are also looking for breast cancers, throat cancers.
Yes.
So how about the volume of these operations when compared with the thoracic operations?
Maybe around 90% of operations are the breast surgery and thyroid surgery. We have a lot of cases with breast surgery here in Macedonia. Also with thyroid surgery, because Macedonia is endemic zone of thyroid disease.
So what's the population of the North Macedonia?
The population of North Macedonia is about 2 million people.
2 million.
2 million.
And
Yes.
how about Tetova?
In Tetova here is about 100,000 people.
100,000.
Yeah.
Tetova is actually the second biggest city
Yes.
in North
Yes.
Macedonia.
Yes.
When you comparing the Skopje University Hospital and the Tetova University Hospital, what are the biggest difference at the surgery? For example, you at a new clinic actually, you start. This clinic starts at 3 years, right?
Yes.
So, what is the biggest difference about these operations? Actually, I'm asking about open surgery, endoscopic surgery, or both centers are the same. What do you think about that?
Maybe now we are in the same level, because in the beginning it was very hard for us to open the new department, the new surgery. It was new for our hospital here, but now every day is easy for us. We have also the big support of our colleagues, international colleagues. What they are supporting us to doing the. I can tell that we have done very big surgery in this hospital.
So, which of the doctors coming from the Macedonia to help us and educate you? Tetova University, actually, I may talk
Yes.
Because I know Diego is coming from here to
Yes,
give
yes.
education, this incredible thing.
Yes.
So,
he's our friend. He has come here many times.
and also you made Balkan tours.
Yes.
Also, Diego going to different cities around Tetova and
Serbia, yes, Bosnia, Herzegovina, Slovenia, Croatia,
Oh,
yeah,
that's
many
very nice.
places, yes.
So your clinics arrange all these educations, right?
Yes.
It's incredible.
We are
So,
arranging this.
Also, I think Firas Abu Akar is
Yes,
also coming
Firas
here.
Abakar is coming here, and also our friends from Istanbul, from Turkey.
Yeah, our
from-
clinic is also
yes.
try to come here for giving education, and I hope in the future the Chinese professors come here.
We are talking also with our colleagues from China, but it's so far from here, and they
It's really difficult.
don't have,
I know.
they don't
It's
have
really
time, yes.
difficult to arrange these things, but I hope he will come because they are really experts, doctors. When you talk about these educations, what do you think about the thoracic surgery education in Macedonia? Because thoracic surgery in all around the world, not so much residency programs, because this is the mostly we are a difficult surgery group. So what do you think about that? In Macedonia, the surgeons wants to become thoracic surgery in Macedonia, or it's not so popular also in North Macedonia?
Here it's not so popular because we don't have a lot of cases here because our cases came in so late, and many of patients is in inoperable stage. We cannot operate it because it's so late.
Because this is because of the screening program.
Yes, that is the reason.
Yeah.
We don't have the screening program.
Yeah, this is the problem in our country too. But what about the COVID? Because in Turkey, after the COVID, we have lots of patients because most of the doctors know how to look at the chest CT scan after the COVID. So is this change in Macedonia also?
Yes, it's changing. Our number is increasing, the number of patients that are coming to our clinic for surgery.
So I know that you have a really good educational program in Macedonia because you sent people to the other countries to gain some experience, and I know that you went to China to take education. So how many countries you visit before?
I was in China, and also I was in Greece. In
Greece, you went to Athena Center?
Yes, in Athena Center.
They are really good at open surgery also.
Yes,
because my friend said that they are really too much case about open surgery.
Yes, that is true. Yeah,
but they are really new about the video thoracic surgery.
Yes.
Also, you come to our clinic.
Yes.
For education.
That is very good experience for us. That is a very good moment for us to see
video thoracoscopic surgery.
Yeah.
But still, I said that China is giving the best education program in the world because they have enormous numbers of cases. So, how about your technology in your hospital? What about do you have video thoracoscopic surgical instruments, and do you have staplers, or you don't prefer video thoracic surgery, you prefer open surgery and using the conventional techniques? Which one you prefer?
We have now everything needed for the new method in thoracic surgery, in WAS surgery. We have the new equipment, the new instruments, also the staplers.
You are not so experienced.
Yes, we are not so
experienced.
Yeah, and that we need more.
But still, support. You tried with your thoracoscopic surgery.
Yes, we have done.
So this is actually important. So because when I came here the last time, you performed uniportal surgery. It's really amazing. But I think because of you have advanced tumors. This is the biggest challenge for you.
Yes, that is true. That is the biggest challenge because when we have the easy case, it's easy to perform in WAS surgery. But when you have the very advanced case, that is impossible for us to do it with WAS surgery.
In advanced surgeries, in the advanced tumors, it's really difficult to manage with video thoracic surgery.
Yes.
Yeah, it's same in our hospital too, and. Maybe this is because of the case numbers. How many cases you performed per month? Thoracic surgery operations, not thyroid and breast cancers.
Yes, our number, we cannot compare our number with your number because this is the small country, the small city, and we have maybe...
but you have 1 or 2 cases per month, right?
Now we increase the number to 5 cases
per
month.
It's really nice. Because in a few years back, you don't have any cases.
Yes, that's true.
So this is the important thing.
Yes, that is true.
So what's the job opportunity for international doctors in Macedonia? Is there any immigrant doctors working in Macedonia, or thoracic surgery doctors works in Macedonia?
For international doctors, it's very difficult to take the license here in Macedonia. That is the reason why here is not so popular to become the international doctor. But in the last years, we tried to change that.
So you trying to, you don't have too much opportunity to other countries' doctors. But how about the visiting doctors program?
Right now, we arrange 2 visiting doctors from Israel and from Turkey.
In Turkey, some of the patients think that the cancer is not operated and only treated with the traditional techniques like herbal medicine.
Yes.
How about in Macedonia? The patients, people believe that the surgery is effective for the cancers, or they believe the herbal medicine. Which one?
I think it's same.
It's a 50-50%.
50-50%, you know, because even in our clinics, when the patient came, before they came to our clinic, they tried with herbal.
Herbal treatment. So this is because
Yes.
getting stage a little bit late.
Yes, yes.
Also, do you have a chance to give them a lecture about, or any meetings, or any education about the patients, about cancer treatments in your university? Yeah, because in Turkey, we have a lots of different community arrange this program and increase the patients' knowledge about the cancers.
Yes.
So how about in Macedonia?
Yes, we have the meeting, some meetings, some symposium, and also in TV, media, but still I think we need more.
You need more.
Yeah,
It's same in Turkey too, because the people still believe that also there's a lot of different types of doctors in our country. Still, they believe that this herbal medicine is really enough for the patient, but we all know that the surgery is the better and best treatment modality right now. Your relationship with other hospitals, is there any doctors coming to Skopje to help your operations? Because I know that your team is not so big, and you are new at thoracic surgery, and sometimes you need some help about anesthesiology or other departments. How about that?
You know, the thoracic surgery is multidisciplinary. And we need help because we are still younger, and we have the support from the Skopje and also support from the international colleagues.
The biggest problem in the thoracic surgery maybe we are dependent on the anesthesiology. Because if your anesthesiologist is not experienced, it's really hard to operate with the patient with the inflate line. So we need deflation. And I think this is the biggest challenge in our surgery. Also, if the patient has too obesity, it's still the problem about our surgery.
Yes, you're right. And here in Macedonia, you have many obese patients.
Yeah, it's same in Turkey too. It's not like a China.
Yes,
in China it's really easy to operate the patient. After surgery, how you care about the patients? What you give about the patients?
Firstly, after the surgery, the patient maybe 1 day or 2 days staying in ECR. And after that, also depends of the surgery. With minimal invasive surgery, the patient after 2 or 3 days going home. But when we are operating in open thoracotomy, the patient is staying longer in hospital.
What's the average hospitalization time in your hospital for the video thoracoscope surgery and thoracotomy?
For what surgery? Maybe 2 or 3 days.
2 or 3 days.
Yes.
It's incredible.
Yes, but we operated easy case with what surgery.
When you operate with the resections,
yes.
How many days do you prefer?
1 week.
1 week.
1 week.
1 week is really nice.
Yeah, 1 week. Yeah.
So, how about the antibiotic usage? For example, in Turkey, our infectious disease doctor says us, you need to give only 1 dose antibiotic before the surgery. That's enough. How do you think about that? Because right now, yes, antibiotic intelligence is really important because of the drug resistance. But the problem is the clinics are the doctors not trust, or sometimes you need to go to home and sleep nice.
Yes.
So giving antibiotics is the important part of this.
Yes.
What do you think about that?
We are using antibiotics here before surgery and also after surgery. For the thoracic case, we are giving 2 antibiotics. But even for the breast surgery, maybe in the ward they are not given, but here we are all time giving the antibiotics.
So I'm really thankful to joining our program. I know it's a little bit stressful for you,
it was.
but it's really nice to come to Macedonia and visit your clinic. And I think it's really incredible clinic. And I hope you are getting better and better every day. And I hope every doctors come to these types of hospitals and sometimes sharing the experience may be most important thing in the world. So this idea, I think, coming from Diego, actually.
Yes.
So
Yes.
I'm very thankful for Diego because he shared his own knowledge to everyone. So right now we're trying to share everyone's experience, everyone's clinic differences to showing us and sharing us our knowledge. I think this is important.
Yes, yes.
And thank you, Besnik,
Thank you
for everything.
Thank you for you coming here and for your support here. Thank you so much.
And see you our next episode. And bye.
Bye. Bye.